my name is Carly Robinson, and I'm in the Clinical Medical Assisting CTE ROP class from the Riverside County Office of Education. I took this class because I thought it would be a good opportunity to learn more about the medical field and become more experienced while I'm still in high school. I have been interested in this field ever since I was a little girl, and I've always been interested in caring for and helping others. My mother is a nurse, and I think this began my interest in the medical field. I saw the way that she helped others, and it made me want to care for people in the same way. In the next 5 to 7 years, I hope to become a registered nurse or maybe even a nurse practitioner. This class has helped me a lot with my goal of becoming a registered nurse or a nurse practitioner because it has taught me how to properly care for patients and perform clinical procedures while also giving me more medical knowledge and better insight into the field. I'd like to thank ROP for enhancing my goals and giving me the opportunity to learn while gaining experience. I believe that taking this class has given me a brighter future. I will be performing injection today, and there are 3 types of injections. First is the intradermal. It is a 26 to 28 gauge needle that's a ½ inch in length, and you inject it at a 15-degree angle. Then there's the subcutaneous injection, and that is a 23 to 25 gauge needle that is 5/8 in length, and you inject it at the fatty tissue at a 45-degree angle. Then there is the intramuscular injection, which I will be doing today. It is a 20 to 22 gauge needle that is at least 1 inch in length, and you inject it at a 90-degree angle and massage it in. So first you have to room in the patient, and you call them in and introduce yourself. Hi, my Guzman. I will be right this way. Okay. And I'm Carly. I'll be your MA for the doctor today. After taking vital signs and performing the HPI, the history of present illness, I will let the doctor come in and talk with the patient. And after the doctor talked to the patient, they came to me and said I needed to do a total milliliter injection. I'm sanitizing my hands again and waiting till it's dry. Putting on my gloves. If there are any, you can just flick them. And then when I'm ready, I take it out. After I'm done drawing the medication, I take off the gloves and then sanitize again. After I'm done drawing the medication, I head over to the patient's exam room. Knock, knock, knock.
Come in.
Hi, so the doctor ordered a 1 milliliter total injection for your pain today, right?
Yeah, that's correct.
Okay, and this will be going in your upper arm today. Do you have any questions?
No.
Okay. So you have to sanitize before you put on your gloves again. And you begin. First, I identify the site of the injection, and it is about 3 or 4 fingers from the acromion, right here. Go like that. And then I'm going to disinfect the area all around here. And you disinfect in an inner-outer motion. And then I'm going to prepare the Band-Aid. And have that stick to my glove just so it's ready when the patient is done being injected. And then I slide off the cap. So you stretch the skin under where I disinfected. Go in quickly. Aspirate. If there's any blood, take the needle out and start a new one. Take the needle out quickly. Injection equipment, while at the same time massaging in the medication. Then massaging in the medication, I check to make sure that there's no bleeding, and I place the Band-Aid on. And I dispose of any needles in the sharps container. Whenever given an injection, you have to check and make sure it's the right medication. You always look for the expiration date. You have to inject at the right time, the right dosage, with the right patient. And you inject at the right site, and you inject with the right technique in the route, whether it's ID, SQ, or IM. And you always have to document. You have to have the right documentation. Thank you to the Riverside County Office of Education for giving me this opportunity and letting me learn more about the medical field.